Thank you for coming to our event, The New Normal with Dr. Mike Ryan, hosted by CADA, Northern Ireland, and the Centre for Public Health at Queen's University, Belfast. My name is Diarmuid O'Donovan. I'm a Professor of Global Health in Queen's. We're delighted that Dr. Mike Ryan can join us for this timely discussion with Marie Louise Connolly, the Health Correspondent at BBC Northern Ireland. The One World Festival is on until Friday the 15th of October with a range of events including talks, discussions, workshops, storytelling, film and much more. Check out the One World Festival NI.com for all the details and do get involved. Now it's over to Marie Louise to talk to Dr. Ryan about the impact of COVID-19 locally and globally.
So, welcome everyone. You're all very welcome to this event. I love the word festival because for me it marks a special time. It means we're setting time aside to have a chat, to converse, to share ideas, to have a big conversation about something very important that's happening. And that's exactly what we're doing here today. And the fact that we are joined up, albeit virtually, it's a positive sign. I think it's a sign that things are moving forward. And the very fact that we have our guest speaker with us today, Dr. Mike Ryan from the World Health Organization, it means that he has found a 45-minute window to speak to people here in Ireland. We're here to talk about the new normal. I suppose it's fitting that our guest is talking to us via Zoom because I think Zoom has become synonymous with this pandemic. It's how most of us are now operating. Hopefully it's not going to become a permanent fixture in our lives. So a very good morning, Dr. Ryan. How are you today?
I'm great, and thank you for the opportunity. And you're right, we do need to take time, even in the middle of a crisis, to think our way through things and reflect a little on where we've been and, more importantly, where we're going. So thank you for the opportunity to slow down my crazy day just for a little while to have this chat with you.
And we're better to do it than with the One World Festival 2021. It's a fantastic event, and it'll be, it's in full swing at the moment. I think when this interview will be going out, I'm going to put you on the spot, Dr. Ryan. If you were to choose one moment, one day over the past 19 months, something that sticks out in your mind, what would that be?
That's a really, really tough question. My memory is very short, but right now I would say what happened the other day at the UN General Assembly, where President Biden pulled together global leaders to say we've got to sort this out, with Dr. Tedros and others, because I think we've been dragging on delivering vaccine solutions to everybody on this planet, and there's been a lot of rhetoric, there's been a lot of talk and a lot of commitments and a lot of promises. But we haven't seen them come to fruition yet. So I'm very recent in my memories of because I think right now we have to change the way we're doing business on the global stage with regard to this pandemic. And world leaders have got together and they've had that conversation, and I really want to see action come from that. So I know it seems like a very late moment, but in the end, you can only change what's in front of you. And if the political dialogue shifts to delivering vaccines in a more equitable fashion around the world, then I think we can end this pandemic, and we can end it in a way we can make a better future for everybody.
Most of us find it difficult still to comprehend that this is the new normal. Do you think in the short term that this will be the normal? We will get on to talk about President Biden's contribution later in our chat, but just this new normal. Is this the new normal, Dr. Ryan, whenever it comes to our health, the way we travel, how we're doing things, just for the short term? Is this the new?
Yeah, I'd like to be talking about a better normal, not a new normal in that sense. But yes, the reality let's say in Europe, people are getting back to something that resembles normality compared to where we were months and months ago or last year. The lockdowns and the massive restrictions on people's lives have ended. There still is a need to be very careful and cautious, and there still are some restrictions in place. but it's still affecting people's lives beyond having a vaccine. There still are issues around movement. There still are issues about large gatherings. But I think we're moving towards the lives we had before. But I hope we don't go all the way back there, because when you look at who has died in this pandemic, the people who have died are very often people with underlying conditions, older persons in homes, a lot of things that drove mortality in this pandemic. The conditions for that outcome were set many years ago in the way our health systems are structured, the way people access healthcare, around social equity. So if we're just going to return to the old normal, fine. If that's about having parties or weddings or about traveling, great. But if it's really going back to an old normal where social inequity and injustice in health was the actual standard, it was the status quo, then that's not a normal I want to go back to.
How do we improve on that then? That is a massive dilemma, isn't it? We know that the COVID killed 4 million people, and it has really put a focus on those poor countries, and particularly around women and children who studies have found have suffered the most. Why do you think in this 21st century, women and children were still targeted?
Well, the virus hasn't specifically targeted women and children. And actually, if you go case for case, men have worse outcomes because very often they have more underlying conditions. But if you look at the socioeconomic and educational impact of the pandemic, that to use that awful term, the collateral damage of this virus, it has really impacted on women in the workplace, women as carers. It has exposed the fact that the vast majority of our frontline health service are women all over the world who are, suffer from unequal pay, unequal conditions. We've seen the impact on education, and as children have not been able to access education, it has mainly been women around the world who've had to pick up that burden of caring for children in the home. So in a sense, economically and socially, this has been a huge challenge for women, but it's not something that happened. I keep saying it, all we're really doing is exposing those realities that existed before, but what COVID has done is amplified and accelerated and brought into the public eye the actual impact of inequity. And those inequities aren't just inequities in distributing vaccine. They're deep-rooted inequities in our society, and they come home to roost when we have a crisis. And we have relied to the great extent on the power of women in terms of the front lines of our health service. We've relied on the capacities of women all around the world to take up, in a sense, the social and economic deficit that's occurred with this pandemic.
Yeah, we've had other crises before. We've had, SARS, swine flu. Is it a case then that we didn't learn from those crises, that the pandemic, okay, it hit harder than likes of SARS, but if we are just lunging from one crisis to another, are we never learning and improving?
There's a yes and no to that. Clearly, on the face of it, we're not learning and improving. I mean, certainly our capacities to detect organisms and sequence organisms and do the science around infectious diseases has greatly improved. But the resilience within our governance systems and financing systems, our health and social systems is just not there. We spend $2,000 billion plus every year around the world on defense. That's what we prioritize. That's what we elect our officials, and they invest in that. That's what's invested in. So those choices aren't made by me at the World Health Organization. Those choices are made by citizens who elect governments who invest in what is perceived to be the greatest threat. And right now, based on the investment, the greatest threat perceived by citizens or governments seems to be national defense, national military defense. And when you compare the amounts of money that are spent on preparing us for a microbial threat, it's minuscule in comparison. Our health systems are not resilient. You see it every winter on the island of Ireland, the health system coming under pressure when influenza, norovirus outbreaks. We see the queues and the lines and the people on the trolleys. That's a reality, that the health system has very little coping capacity. And you don't have to put too much pressure on the system for it to become very inefficient And that lack of resilience, that lack of capacity to expand and absorb the shock of an infectious disease has knock-on effects into our society. And I think that's where it's not just about preparing by making better surveillance or doing genetic sequencing. It's about preparing as a society as a whole for these things and preventing to the great extent possible, and containing and then responding. And we just have not collectively, nationally or globally, invested enough in this over the years.
Do you feel that you're constantly firefighting, that in order to convince the likes of President Biden, Boris Johnson, the Prime Minister, Micheál Martin, you know, the First Minister of Northern Ireland, the Northern Ireland Executive, is there ever time to sit, to be creative, to look at how money is spent and spent wisely? For example, this week in Northern Ireland, there has been a debate around social care. Northern Ireland's health and social care are integrated, unlike the rest of the UK. But the argument has been all the money has gone into hospitals, and rightly so, many would argue, to fight the pandemic. But in the meantime, social care has been neglected, and has been neglected in many countries for over a decade. But how do you shift that argument? How do you ensure that the hundreds of millions that are coming into the country, for example, as the new health and social tax levy, is prioritised and is spent wisely? And we're talking very small scale in Ireland when you compare to how money is spent worldwide. But isn't it up to the World Health Organization to convince governments why they should spend more money on public health?
It is. We're a secretariat to 194 member states, and if you think about this, because people say, "Oh, the World Health Organization," the World Health Organization is actually a club of 194 governments, and they come together once a year for a World Health Assembly, and they set the global policies. We are the technicians, we're the operators, we're the bus drivers in terms of making that work. We're a civil service, in effect, a scientific civil service within that. And we push and we advocate, and I've advocated for years, as many of my colleagues have, for greater investment in preparedness. But you know, in any walk in life, we're as human beings, and I think this is, you know, sometimes we put this on the politicians, and there are real governance issues around the world around this issue, right? And it doesn't matter how industrialized or how fragile a country is. There are issues around the governance of this area. But the reality is that I think as human beings, we're, I suppose, hunter-gatherers at heart, and we're very focused on proximal risk. We're very focused on paying the bills this week. We're very focused on dealing with the risks to us, our health, our family, our communities today, right? And we tend to discount future risk because you can't survive as a human being if you think about every risk in the future and you prepare for that, because you've got to feed your family today. You've got to go to work today. And we've seen ourselves sleepwalking towards climate impacts. We're sleepwalking towards these health impacts we've seen with preparedness, and sleepwalking towards the long-term impacts of social inequity and social injustice, because they're down the line. When we think about how will this impact us in 10 or 20 years' time, most people are saying, hang on, I want to know what I'm getting paid at the end of this week because I have a mortgage to pay. And people tend to, we all do this. This is a human quality. And when it comes to elections and when it comes to everything else, we get very caught up on short-term issues, because that's what matters to us on a day-to-day basis. So to get us as a society, nationally and globally, to start looking forward and saying, what sort of a society do we want for our children, to be able to, you know, as I've said this before, we're writing checks now that our children are going to have to cash in future, and it's not working. So there needs to be a big adult discussion. Now, I'm seeing some changes. I mean, certainly the G7, the G20, the UN General Assembly, the World Health Assembly, there's been a huge shift in focus onto this area of resilience in health systems, health justice, universal access to health care, preparedness, and all of that. And yes, it's great, but I'll be very frank with you. Right now, it's rhetoric. Right now, it's talking.
Is it all lip service? You know, does it sound good coming from the platform, from the likes of the G7 summit, where they know it's all about sound bites, it's all about the message that will be broadcast in various news programs throughout the world? But what are you seeing that's tangible? What is actually happening that, you know, someone in Africa can feel is impacting on their life?
Well, if I look at it in terms of what's happening politically to try and change the game there, certainly there's a huge move now within the G20 to look at a health financing board that will bring together ministers of health and ministers of finance. Because and I'm sure it's the same in Northern Ireland as it is down south, and on the island as a whole, that the Minister of Finance holds the pen when it comes to financing anything. And therefore, the need to bring health and finance together to look at what are the economic benefits of investing in health. It's not just a cost. All governments around the world see health as a cost. It's an expenditure. It's written in the expenditure, not an investment, not a protection.
It almost feels like a nuisance. There's a huge debate, Dr. Ryan, in Northern Ireland at the moment, because we're about to get our budget in the next couple of weeks for health. And we had our finance minister talking it up yesterday and more or less laying the ground that if health is to benefit and to get any additional money, well, that's going to come at the cost to all the other departments. So, are we prepared to let our roads suffer, communities, perhaps education, to the benefit of health? And again, that's small scale in Northern Ireland compared to everywhere else. But
it's the same discussion going on everywhere else. It's the pie, and the pie is the same size. So if we get more, others get less. It's the same issue here at WHO. I don't want to promote preparedness here and get more money for surveillance if the result of that is there's less money for TB and less money for malaria. What we need is a shift in the way we do the overall financing of systems and government, and where is the priorities actually lie. And if it's just a matter of moving health from the social sphere into the health sphere and then back into the social, and you're just really robbing Peter to pay Paul, you're just doing that all the time. And that's been the way of things. There needs to be a fundamental shift. We're going to have that again at COP in Glasgow. Is there going to be a fundamental shift in what we invest in as a society? And I think climate justice, social justice, and health justice are now colliding. You cannot separate them anymore. The one is impacting the other, and I think we're at a very important moment in human history. I don't want to be a negative person here. I have seen, and I'm sure you've witnessed, some of the greatest selfless acts, communities organizing themselves, food banks, health workers going to work with their faces scarred with the scars of masks and gloves, patients, the bravery of patients who've been in ICU and people on CPAP, people on ventilators, the bravery of their families, not been able to see them. We've seen some incredible mobilization of communities and societies. We're seeing that. The issue now, I think, for citizens is not to stop, is to say to our political leaders everywhere, nationally, regionally, globally, we want to invest in health, and we don't want that at the expense of something else. This is no longer an expenditure. This is a human right. This is an investment in the future health and welfare of our society, and we need to change how we finance that. We need to change how we look at that. That doesn't mean that the health system doesn't have to become more efficient, more relevant. It's not saying, well, just give us more money and things will be better. We know that. In many societies, just chucking cash at something doesn't make it better. The systems need to evolve. We need to get more patient-centered. We need to get more community-centered. Our focus in health systems has been on tertiary care. And it's true, if I get a brain tumor tomorrow, I want the best brain surgeon in the world operating on me. That's easy to think about, and that's easy to fund. It's harder to fund long-term health promotion and health protection and supporting communities so that we don't get in health and we don't have huge rates of diabetes and hypertension and mental health and stress in our communities. That's what's driving the long-term mortality, the long-term demand in our health system. But when we look to react to that, we tend to invest in downstream activities that are basically putting the band-aids on gaping wounds.
It's back to the firefighting again. Let's turn our attention, our conversation now to the rollout of the vaccine globally. How equitable has it been?
Even to say how equitable has it been is almost a contradiction in terms. It's been deeply inequitous. Now, from my perspective, and this is something we have to understand, sovereign governments are bound to do what they can to protect their citizens. So national governments have done what they needed to do with the money they had to develop the countermeasures, to distribute and release those to their populations. I'm not about to criticize individual governments for seeking to do what they were elected to do, which is to protect their citizens. However, as a global strategy in looking at this, we've had plenty of vaccines that we could have shared. We've had too many bilateral deals, too many people cutting the line, cutting the queue, manufacturers making bilateral deals, not providing money into the COVAX facility so we could share vaccines more equitably. And the result of that has been health workers and people with very severe underlying conditions in many low-income countries not having any access to vaccines. And that is not only inequitous, unfair, and unethical, it's also daft, because what we're doing in doing that is allowing the virus to continue to transmit intensively in those countries, raising the stakes of new variants emerging that could escape the effectiveness of our existing vaccines.
So why did it continue? Why did no one, including perhaps yourself or the World Health Organization, why did no one speak up sooner and say, this is unfair? And I'm curious to know, how do you feel about countries, including Ireland, who are vaccinating 12 to 15-year-olds? You know, is that necessary when people not so far away haven't even smelt a vaccine? Is it every country fending for itself? Is that the way it has been? And how do we change that? And should we be questioning vaccinating 12 to 15-year-olds?
There's a lot of questions there. I'll try and answer them. I think if you go back and look at certainly my public pronouncements and those of Dr. Tedros, we've been screaming about this inequity issue going back into last year, as soon as the vaccines were put on the table. That's why WHO, working with UNICEF, with Gavi, pulled together the COVAX initiative, in which we created a framework by which everybody could share vaccines, and which we could distribute vaccines based on some epidemiologic principles of need. COVAX works. The problem is we haven't had access to the vaccines in the way we could or should have. So I don't, we've been concerned and speaking and acting on this for a very long time. A number of countries have contributed funding into the Access to COVID Tools Accelerator. So everyone has done something to try and help the inequity situation. The problem is we haven't done enough, and we haven't done it in a coordinated fashion. With regard to vaccinating younger persons or teenagers, or even now with the booster issue, again, governments have made those decisions based on their determination of the best interests of their citizens. What we're saying is there still is plenty other vaccine. Some countries have bought 5 times the amount of vaccine that they need. So we're not talking about, and this gets turned into an either or argument. Are you saying, Dr. Ryan, we shouldn't vaccinate our kids? Are you saying we shouldn't give boosters to those people with immunocompromise? No, I'm not. What I'm saying is there's enough vaccine to get to minimum levels of vaccinating all over the world, which will save lives. And I've said it before, I'll say it again, with boosters and other things. We're handing out second life jackets to people who already have one, and we're leaving other people without a life jacket, and they may drown. So these zero-sum games where we say it's either or, it's not. We can do all of these things. We can vaccinate younger persons. We can give boosters to those people in our population who require a third primary dose because they have an underlying condition or because they're immunocompromised. And we can accelerate the delivery of vaccines to all countries. It is all possible. The numbers are there. But if manufacturers keep prioritizing bilateral deals,
how do we make it happen?
Well, Dr. Tedros has set out a target of 40% coverage in every country in the world by the end of the year. We think we can get there in all but 50 countries right now. We're looking for that acceleration of vaccine donations, and we're looking to the manufacturers. It's not even donations. We've got money to buy vaccine. The issue is to get the manufacturers to prioritize our orders.
Yeah, usually it's about the money. Usually we hear, we haven't got the finance, or
there's a lot of financing in place. There's a lot.
We haven't got the system. So what's holding it up?
As I say, it's multifactorial. We've got a limited number of manufacturers who produce licensed vaccines, who've got production facilities mainly in the north. So what we're seeing now is an increasing transfer of production capacity for some of those vaccines into the south, sub-licensing or contract manufacturing. We've seen AstraZeneca take the lead on that. with contract manufacturing in India and Korea, and to their credit, they also set out with a zero profit objective from their vaccine. But the mRNA vaccines and others, they're complicated technology, and the technology transfer for those vaccines is not as straightforward. But we need to see that expansion of manufacturing capacity around the world. We need to see, and we've seen the ramp up in vaccine in production capacity amongst the manufacturers, which is good. Now we need to see that increased production capacity prioritized for people who have no vaccine. And look who's dying even in Europe today. We've 500,000 cases a day around the world. We still have over 10,000, well, not quite 10,000. The numbers have dropped in the last couple of weeks, thankfully, but around 10,000, or 500,000 cases a day and 10,000 deaths per day. The vast majority of people who are dying with this vaccine or with this virus, and the vast majority of people who are on ventilators and are severely ill, are people who are unvaccinated. This is becoming a pandemic of the unvaccinated in terms of severity. And we can stop that. We can end that. People ask me all the time, will we be able to end the pandemic? And I say, yeah, we can end the pandemic. We mightn't end the virus. The virus will stay around for a very long time. Yeah, there'll be an afterglow, a half-life to that virus that may go on for years. The issue is not that. The issue is, when will this virus stop killing us, stop putting us in hospital, and stop disrupting our economic and social lives?
Well, that's a huge incentive, is it? And I suppose the next question is, how do we ensure that we do finally get a people's vaccine and not a profit vaccine?
Well, as I say, some manufacturers already taken that route. The People's Vaccine Initiative and the NGOs and CSOs that are involved in that are to be commended for keeping the advocacy going around this. It's very, very important. But obviously that's then got to translate into manufacturing capacity. It's got to translate into financing. It's got to translate into an allocation plan that's fair. So what we're trying to do is our bit in driving manufacturing, driving funding, driving allocation. But we need initiatives like the People's Vaccine Initiative to be out there pushing, shouting, and pressuring for this. Because a pandemic is not like any other event. Pandemos means, from the Greek, demos is the people, and pan means everyone, and it means all the people. All that means is a pandemic, everyone's at risk, everyone's at threat. So in that sense, we need a collective response.
I sense, again, from Northern Ireland, the Republic of Ireland, people are tired, aren't they? People are fed up.
We're all tired.
We're all tired, and we're all a bit fed up with the pandemic. But it's trying to harness that energy that the charities who are listening to us at the moment, Mike. We've got Save the Children, Oxfam Ireland, Concern, Trugra, all these fantastic charities who do so much good work. But they are preaching to people who really just want to get on living, don't they? And that's a huge challenge, trying to harness that passion and also to keep government's attention focused as well. That if we are to get over this pandemic, okay, the virus is always going to be with us, but if we are to move forward, we need to keep people's attention. And that is becoming really, really difficult.
Yeah. And I don't blame people. People want to get back to their lives, and they want to get back to their education, and they want to get back to their social lives, and they want to get back to traveling and ensuring their own futures. I mean, that's a natural. I'm very much the same myself. But we still have to do things. I think people certainly on the island are going to have to continue to be vigilant themselves, protect themselves against exposure, and protect others from exposure from them, because even with vaccination, transmission can occur. And that's going to, what's happening with governments now, governments are really beginning to pass that responsibility primarily back on individuals. And say, well, you need to do that now, and hopefully that will avoid lockdowns and all of these other issues, because we're heading into the winter period.
Yeah. How likely do you think, we've been talking this week, the Northern Ireland Executive met yesterday, and the 9 restrictions that remain here, they're going to remain for another couple of weeks. There are some soundings of perhaps a circuit breaker, a lockdown, and really that is to save Northern Ireland's health service, which is really toppled over. Exactly. But how likely is a circuit breaker, perhaps at around Christmas time?
No, let's see. I think it's very much going to depend on two things. One is, to what extent are people who are likely to get sick or die fully covered with vaccines. Right? So so yes, maybe vaccinating 12 to 19-year-olds or 19 to 25-year-olds get people back to college, but those aren't the people that are going to fill up the ICUs at Christmas time. It's going to be very much people who are unvaccinated in those vulnerable groups. So there needs to be a double focus on that. It's not just the absolute number of people you vaccinate. And this pursuit of we've got 92% or 73% people vaccinated, that's an important number. The number I want to know is how many of the people who are really vulnerable to the bad effects of this virus, what proportion of them are covered in long-term care facilities, older persons, people with underlying medical conditions, are they covered? Because they're the people who will suffer in this. So if there's a focus on both, I think this will be good. Also, just a general focus, and it's interesting to me, who haven't had high levels of vaccine delivered to them. They've managed to keep the disease under a great deal of control, and not the Australian and New Zealand model, which has been a very effective model, but with very big lockdowns. Some countries have managed to really create a really good trust sort of contract with their own populations, and people have really informed themselves of the risks and just try to keep transmission of the virus to the minimum possible by taking the basic measures of just trying to avoid crowded places. You know, don't be sitting inside in poorly ventilated spaces. Wear your mask if you need to wear your mask. These things they won't stop every infection, but what they'll do is keep the pressure wave low, and then the vaccines will do their work to protect the vulnerable. And then we could get right through the Christmas period and right through the winter.
A great debate this week, a very sensitive one, controversial. Should health workers or should vaccines come compulsory?
Oh, that's a really tough question, because
it's a hot topic.
Yeah, and it's so dependent on national culture in terms of what expectations are and what that social contract is with government. I'm generally of the view that it is better to persuade and convince someone of the benefit of a vaccine than force vaccination, because it creates a lot of tensions. It creates a lot of tensions in communities and in societies, us and them. Having said that, there are environments like healthcare worker environments and environments where, you know, patients and others may be infected, where it's not just about you, it's about others. So, and other people who are potentially vulnerable. So it's a very difficult ethical discussion. I believe everybody should be vaccinated. The question is, do we believe that this should be coercively implemented in a way that it becomes policed in that way? And our experience has been, in general, that can be counterproductive, but it very much depends on the society in which this has been implemented and what the society's contract is with government, what the level of trust is with government. Therefore, it's really hard to have a one-size-fits-all around the world. But I think we need to get very good. People have rational questions about vaccination. And it's not that everyone who's hesitant about vaccine is a conspiracy theorist. And there's been an unfortunate mixing of these two things. There are people on the extremes on the vaccine conspiracy side, and we're all having chips put in our heads and everything else. And fine, they're out there and they can have their conversation. But the vast majority of people who are hesitant about vaccination are hesitant because they're getting information from all sides. They're confused. They need to get credible, trusted information. They need to be given time to consider that and multiple opportunities to access the vaccine. It can't be difficult. If you make the pathway to vaccination difficult and people have concerns, you know, we'll all do it. If I'm doubtful about doing something and it's also going to be very hard to do it, as a human being, I give myself permission not to do it. So I think governments need to redouble their efforts to make vaccination as widely available within communities as possible, especially marginalized communities who may not access or want to access vaccines in the official ways. Right now, you nearly need your birth cert to get a vaccine in some countries, and there's so much documentation of who you are and what you do and what your phone number is and everything else, that if I was a migrant or if I was an undocumented migrant in the country, I'd be potentially scared witless to be standing in a vaccination line. So there are elements there around how we can make the process of accessing a vaccine as easy as possible, and how we engage with people and communities to persuade them, to give them the information and let them make good decisions. And at the same time, we need to counter the misinformation.
Time's marching on. I want to get on to the responsibility and, you know, whose responsibility is to checks and balances and to ensure things that we want to happen can happen. The Pan-European Commission on Health and Sustainable Development, which is convened by the World Health Organization to look into how pandemics can be prevented and how best to improve checks and balances, it has published its report. And while it wasn't commissioned, Dr. Ryan, to find fault and to lay responsibility at any one door, but does the World Health Organization feel that the Commission found that who could have done a lot better?
I think everyone in any crisis, when you look back, you can always find what everyone could have done better. Right now we have a tsunami of reports. If I can keep my door open and all the windows open with all the reports and all the opinions, and it's great because we need that. We need that dialogue. We need to look at failures in preparedness. We need to look at how we ended up in this situation. But remember, we're fighting a brand new novel virus that emerged and spread around the world. We've had to learn so much about how to fight it, and I think we've done that together. But there are huge lessons to be learned, and that's what's being discussed now. We have an extraordinary World Health Assembly coming up at the end of November to look at just these issues. We've had an independent panel on preparedness and response. We have a global preparedness monitoring board. We've had multiple reports, and that's nothing to the national. In fact, WHO has been involved and having to deal with multiple international inquiries around the response. We've seen very few national ones.
I'm sure you don't need multiple reports, Dr. Ryan, for you to, when you think about things, to know, was the global community properly protected? More could have been done, but whose responsibility was it to ensure that we were better prepared for COVID-19 pandemic?
Everybody's. The 194 member states of the World Health Organization. It's like anything. Who's responsible to ensure we're prepared for climate change? The people that are attending the COP conference next month. That's the reality. This is a collective responsibility for everyone. Certainly in the emergencies program here in WHO, I think at the moment we're dealing with 63 emergencies around the world that aren't COVID, from Afghanistan to Yemen to Libya to Tigray to meningitis, hepatitis E, cholera, Nipah virus, Ebola virus, and many other things. So we operate as a group, humanitarian and health emergency preparedness and response group. We're a technical operation. We work with many of the agencies that you just mentioned earlier, like Oxfam, Save the Children, MSF, and so many others in the front line. But we're a thin blue line. We're a small operation when it comes to being that thin blue line, as many of the NGOs are in these fragile, conflict-affected and vulnerable settings. 70% of high impact epidemics are occurring in 30 countries that are fragile, conflict affected, vulnerable, have real issues going on in them. Nobody cared about that. Nobody was jumping up and down 2 or 3 years ago. We've been screaming about preparedness. I've been in this organization in various guises 25 years. We were speaking about the World Health Report in 2003 on SARS was around global pandemics.
So why didn't we learn from that then? Whose responsibility is it to ensure that in 15 years' time, if you and I are here chatting again, that we don't look back and we aren't saying, well, we didn't learn from the COVID-19 pandemic?
I think it's everybody's. It's a bit like the climate change thing. It's everybody's. Look, the primary responsibility lies with governments. It lies with governments to put together the financing, the governance, and the systems and tools that we need globally. But the reality when it comes to epidemics, and it's a very, very important one to remember, there is no global system that can prevent or stop pandemics. Global health security is based on a fundamental principle of connected capacities globally. It's not a global system. It is made up of all of those national and subnational surveillance, response, preparedness systems. WHO's job is to connect all of those capacities together, but you can't create a global thing that takes care of gaps in national systems. WHO can't fix poorly funded national health systems. WHO can't fix poorly funded public health systems at national level. So this is really about developing a global architecture, but that it's based fundamentally on strong national systems that are connected in an unbreakable chain of preparedness. And therefore, it's going to take all sides to make this work.
Okay, I get that. I get everything that you've said. But if we are to learn from what has happened, for instance, there was a WHO investigation into what happened at Wuhan. And at the end of that, there was nothing concrete really come out of it. You know, there wasn't a definitive answer, a definitive report into a very extensive investigation as to what happened in Wuhan. If, you know, why not?
Yeah, that's very much, there's an awful lot of work going on. And the team that went to Wuhan was a very, very expert international team made up of experts from multiple institutions, many from Europe. And that team actually, if people would go back and actually read the report, which most commentators have actually never done, what they've done, most people, is they've commented on other people's comments, and they've commented on the geopolitical argument around that. I would really point people to go back and look what was actually done and what was pulled together. That is the only mission, and it's the only mission that has gone into China. Where we had a previous mission on the response earlier. Our job as representing our member states is, and we investigate epidemics all around the world every single day. The answers weren't found because the answers are hard to find. It took us years to find the source of MERS. It took us decades to find the source of Ebola. We didn't even know what HIV was for nearly a decade, and we never fully understood the source. So the reality is that finding sources of novel infections is not easy. It is complicated, and it requires full cooperation of everyone in the process. We are not the police in WHO. You know, we are scientists, and we are empowered by our member states, or we are disempowered by our member states to do that work.
Do you think the WHO does then need more powers in order to be effective?
I think WHO needs more support, it needs more funding, and yes, our mandate does need, I believe, to be strengthened. And there is a big discussion going on at the moment between our member states. There's actually a formal working group of our member states working towards the World Health Assembly. That's only the second time in history that WHO is having an extraordinary World Health Assembly, and it will actually discuss the need for a new international political compact agreement convention on exactly these issues, on equity, on sharing vaccines, on investigations, and all of that. And it's really going to come down then, no more than it does in the United Nations, to the member states of our organization, the governments agreeing to that. And again, civil society has a role to play there, because I think civil society can activate and push governments to come to some better agreement. But the word power is a double-edged sword. WHO needs capacity, it needs the ability to do things better, and it needs to be supported by a stronger framework of governance. But that WHO, we do not become the police. We implement the will of our member states. That's what we do.
Our time, we've got you for another couple of minutes, so very quickly. Lots of people, charities who are listening to you, Mike, and if you were to give them some encouragement, you know, it's been a difficult 19, 20 months. People working from home, people perhaps thinking they're not making a difference. But for those who are watching this, what would your advice be to them?
Keep doing what you're doing. I've engaged with so many civil society and non-governmental organizations over the last year now, especially in Ireland, and the difference that organizations have made in communities on the island and beyond through the international components of NGOs abroad has been amazing. Certainly, I've witnessed the work done in refugee camps amongst migrants, against those that governments might not necessarily have prioritized in this pandemic. NGOs done a tremendous job in highlighting and providing services to those. Keep it going. But I do think that we all are exhausted with the work we're doing, the operational demands, all of that. But we all need to get smart now as well. And I think we need to come together and really do the political advocacy needed to change the game. Because humanitarians and others just keep going there for years. And we've had these crises before, and hunger crises, and we've had various things. And NGOs just do it every time. And we try to do our best every time. But now, as we continue to try and do our best, we've got to activate ourselves to change the political narrative, to change the dialogue, because something's got to change. And I would say that's the same with climate. It's the same with preparedness. We have got to influence now. So the only advice I would give to NGOs is keep doing what you're doing, because you're saving lives and you're saving communities. But let's work together to influence the future, because those conversations are happening now, G7, G20, the UNGA and other places, and civil society needs a voice in those discussions. And I think it needs a much bigger voice in those discussions.
Okay, fine. Finally, One World Festival. It's a really positive event. And I started off this chat, Dr. Ryan, by saying I love the word festival, because it does suggest that we are doing something different, we're enjoying something, that we're making a difference. I want to end this on a positive note. It's been a pretty dismal 20 months. We're looking forward, and my goodness, in a couple of months' time it'll be Christmas. But what can we learn? What should we take away positively from the past 20 months?
For me, we've learned that the very fact we're so connected around the world makes us very vulnerable, because these viruses move along social chains, move along our economic, social sort of tributaries in our society. But what we've also learned is that connectedness between us is hugely valuable, be it at community level and someone setting up a food bank, to scientists engaging in sharing data that they might never have shared together before. So what, for me, is we need to reconnect with, or rediscover, that it is connectedness between people and communities that is the real driver of innovation. It's the real driver of equity. It's the real driver of solutions. That's been forgotten a little, because we've seen that connectedness has been our greatest weakness. We don't see ourselves as a community anymore. Many countries, it's become very individualistic. We don't see community at the center of what we do. I think this pandemic has taught us that communities matter, that equity matters, and that if we can use the way we're connected now, you said it through Zoom earlier, if we can leverage the fact that we're a connected global society, not to fight and politicize everything and have geopolitical spats and spend so much money on defense and drive our climate into chaos, if we could just step back and actually say, we could use that connectedness for something much more profound, something much more just. And that, for me, I get up every morning and sometimes I look in the mirror and think, oh my God, another day, am I going to do this? And then always there's just, you witness some act of a human being helping another, someone helping someone onto a bus, someone just holding a door for somebody else. And you realize that actually we tend to be down, we have a rhetoric that projects us as greedy, as self-centered. And that's fine, because in the systems we have right now, that's good. But you want to stimulate that in people, because they're now turned into consumers. And you want the consumer to want to buy something ahead of everyone else and have a bigger car and a bigger house. We've been trained. It's almost Pavlovian conditioning. But actually, I don't think that's our instinct. I think at heart, as human beings, we're collective in the way we look at things. But that's been sort of beaten out of us over the last generation. I just hope we could rediscover that sense of community and that sense of human connectedness. And you're never achieving anything unless you're really serving somebody else. That is the greatest source of happiness that anyone will ever have. And NGOs, civil society organizations, they embody that. They're my heroes, because they do that. They walk that talk. They're not like politicians. They're not like shiny ass bureaucrats here in Geneva. They actually go out there and they embody that spirit of community and connectedness.
Well, there's been a great connection between here and Belfast and yourself in Geneva today. Thank you for your time. It's been a good chat. And no doubt we'll be chatting soon. Thank you, Dr. Ryan.
Thanks very much. Really enjoyed it.
Hello everyone, my name is Jeannie McCann and I'm involved with the Coalition of Aid and Development Agencies who are putting on the One World Festival this week. Thank you so much to Marie Louise Connolly and Dr. Mike Ryan for their time today. That was a fascinating conversation. Thank you also to everyone at the Centre for Public Health at Queen's for their support in putting on this event. Dr. Ryan reminded us that COVID-19 illustrates how small, interconnected and interdependent our world is, and that now, as we hopefully emerge from the pandemic, we have the opportunity to build back better. But it has to be better. We now have to build a more just, equal and sustainable world for all. And Dr. Ryan spoke about the importance of political advocacy to make that systemic change happen. And of course, as citizens, we all can get involved and lend our voice to campaigns that are happening all around us. One very practical example is the People's Vaccine Global Campaign, which calls for equitable access to COVID-19 vaccines and technologies around the world. You can find out more, get involved and lend your voice at thepeoplesvaccine.com. Lastly, tomorrow is the last day of the One World Festival. There's still lots of events to come and lots for you to check out, so you can find out more at our website, oneworldfestivalni.com. Thank you.
It was